You're watching the News Hour at 9. Debate number 1 on Times Now. Super Prime Time.
And joining me tonight, Dr. Randeep Guleria, Director of the All India Institute of Medical Sciences. Also joining me tonight, Dr. Ashok Seth, Padma Bhushan and Chairman of Fortis Escorts Heart Institute. Dr. Guleria, it's not just a COVID crisis that India is facing, it's also a credibility crisis. And the credibility is because norms keep changing along with the availability debate that was already going on. So the question on India's mind tonight, not just the political circles, generally people are saying that international studies in UK, Germany, Australia have said 12 weeks is the time period maximum between the first jab and the second jab. And today we are told, well, 4 से 8 हफ्तों में आप ले रहे थे, अब 12 से 16 में कर दीजिए. Dr. Guleria, is this just casual, one day morning you decide because vaccination availability is causing a hue and cry, or is there a scientific basis for this new recommendation?
So there is a scientific basis, and one must understand, as the pandemic evolves and our knowledge becomes more and more, the recommendations will change. We keep saying that any document is a living document because it will change. We started off 1 year ago by recommending hydroxychloroquine. We are not recommending it now. So there will be changes in terms of what we are recommending. We did not recommend steroids at all for moderate to severe disease. Now we say that they are life-saving and should be given. Now the studies which have been done through various trials and modeling studies have really shown 2 or 3 things. The first thing is, if we delay the first shot, the second shot after taking the first shot, is an individual protected or not? The data that has emerged from analysis of 4 large trials shows that you get more than 70% protection from getting symptomatic disease, that is getting severe COVID, going into hospitalization or dying, even if you were to take just 1 shot. And therefore, even 1 shot and given to you gives you protection for more than 12 weeks. So it's safe if you take 1 shot, you are still protected. The second issue was how is the immunity which happens between what is the priming dose and the boosting dose. The first is the priming dose. That primes your immune system to really develop a good antibody response, and when you again give the second shot, it really causes a good immune response, both in terms of T cell response, in terms of the memory cells. Now what has been shown is that if you give the body a little longer time for the priming, then the immune system responds better, and data clearly suggests that if you are taking the shot within 4 weeks, you get a protection of only around 55 to 60%. But if you delay it to around 12 weeks, your protection goes up to 80 to 90%. Based on this data which has emerged more recently, and after a lot of deliberations, the INTAGI, the group which looks at this, recommended that we should consider delaying the dose because it is giving more protection, and in the interim period, people have good amount of protection, as I just mentioned. You're also right that this is a strategy which may help us to vaccinate more, because then if we are giving 1 dose, we can cover a larger number of people. This is the exact strategy which the UK adopted when they had this huge surge of cases in the southern part of England, when the UK strain caused havoc out there. So I think there is a lot of logic both in terms of the science and the public health issues in terms of promoting the strategy which has currently come out. This has also now been looked at for pregnant women, lactating women, and I think that is also very sound and something that we should aggressively promote.
Well, Dr. Ashok Seth, I want to ask you, because people are now questioning that is this the finding that is dictating the gaps because, availability is problems, or is it the scientific studies? And have these scientific studies really emerged just over the last 5 days since the clamor in states have begun? Or were these scientific studies available before? Why have we waited so long? These are common questions that our viewers have been asking, normal citizens have been asking. Where do you think this is coming? Is it the cart leading the horse or the horse leading the cart?
So, Navika, let me just state firstly that I won't want to discuss around the intelligence, and those are experts, virologists, epidemiologists, vaccination experts in that committee. But let me just say that, yes, it's a bit of both, isn't it, at the end of the day? It's the right strategy, clearly, based on science. It's also the right strategy at the moment, based on epidemiology, based on public health issues. But you're right, this data was there in February even. And at that time, I wondered why we had just gone to 6 to 8 weeks and not 12 weeks, when even WHO had suggested at that time that the vaccination period should be at 12 weeks. In fact, that was February. And England had already expressed the fact that they would do one dose so as to cover a wider population. And I still remember the NTAGI chief saying at that time that we're not convinced about the data. That strategy is meant for countries which have non-availability of vaccination. We have enough of vaccination, so we don't need to worry about that. That was actually the statement. Having said that, let's not go into that aspect. But it is true that it is a bit of both. Yes, data is sound. It's got sounder that if we actually vaccinate at 12 weeks, and I'm not sure where the 16 weeks has come from, but I guess it says after 12 weeks, or between 12 and 14, perhaps there's nothing much to choose, that you get a better efficacy of the vaccine, but there's also more convincing data that even with one dose, you actually have a 60–65% efficacy, so it prevents you from having the disease, even with one dose, up to 3 months period, and also the fact that you have a 50% less chance of transmitting the disease, and secondly, you have an 80% less chance of dying from the disease even with one dose. So that's a fairly high level of protection that you're getting for one dose up to 3 months. Of course, coupled with the fact that the present situation of inability to vaccinate a large number of people, of the shortage of vaccines as we see, and the fact that we should try and cover a larger population as fast as possible, I think these are both the situations, and we have to be fair to the both. They've got to look at every aspect. They've got to look at every aspect as it stands today, not as it stood 2 months ago, and perhaps they would have to look at it as it stands in a month or two's time. I think the step was correct, and it had both those issues taken into consideration when deciding on this.
Well, so Dr. Guleria, where did the 16 weeks gap come in from? Because international studies have spoken up to a maximum of 12 weeks. Why do we in India think a 16-week window is something that's going to be better, or nothing much of a difference between the 12 weeks or the 16 weeks? Number one, because where is the empirical evidence on that? And number two, as Dr. Seth just pointed out, these studies were present even in February. Why have we decided to follow them now in May, when many deaths have occurred in India? Why this delayed awakening?
So first of all, the first question, the data suggests that the interval should be more than 12 weeks. And therefore, more than 12 weeks could mean 12 to 14 weeks, 12 to 16 weeks. You will have to have a range, because you can't say everyone should get vaccinated at exactly 12 weeks. There will have to be a range. And the committee looked at the whole data and felt that a range of 16 weeks would be practical, both in terms of delivery system and in terms of the safety the data that was available. Regarding the fact that this data was already there, yes, the study that was done have been done in the early part of this year. The data has been looked at, but more data has also emerged from Canada and other countries. But I do agree that this data was there, and the Lancet article was published way back in February. The issue is that when this was discussed, I'm not a member of the NTAGI group, but when this was discussed in the group, there was no consensus in terms of the whole group coming to this decision. You see, whenever you have to take a call on such things, a consensus has to be developed by all the experts. If that is not there, then you will park this proposal and then again look at more data and then come out with that. So the data has emerged over the last few weeks, but the experts have to really look at it critically, and once they're convinced, then only do they recommend it to the government or to other bodies. So I think that is the basic issue. You see, the issue is, it's in hindsight, one can always say that we should do this, but if it had not worked out, then the same critics would have said, why did we do it? And we should have waited for some time, and then only if the data had emerged, we should have done it. So it's easier to say it right now, but at that point in time, the group actually felt that we should get more data before we really go for this strategy.
Well, I know, Dr. Guleria, scientists and people like you are in a tough spot because apart from criticizing and feeling the anxiety and putting it out, we people are putting a lot of pressure on our scientists, and we understand that. But this is a huge population who doesn't understand this kind of scientific information, and therefore questions are just legitimate questions that arise in every thinking mind. So let me ask Dr. Seth tonight. Dr. Seth, another new SOP that's come out is about waiting for a 6-month period after your COVID positive case. Is that again scientific and supported by data and studies abroad? Because antibodies, we were last told, are present in your body till up to about 2 to 3 months after you've turned negative. Now we're talking about a 6-month window. Is that also scientifically proven?
So now let me just say that the single dose strategy is the right strategy to go totally support the government, even if it made the decision now and not earlier. Now, going on the similar aspects, we must understand that more data has come forth about reinfection with COVID virus. And by the way, the antibodies do not correlate with the level of protection. That's well understood. And that is why we discourage measurement of antibodies apart from epidemiological surveys, but not for personal protection, because there are T cells and B cells which take part in the personal protection. What has been clearly seen and come out more forth is that you rarely get an infection up to 6 months, a reinfection up to 6 months after a COVID. Now that has led to this committee getting together and saying, what is the time frame that we're going to put at? Earlier, as you recognize, the time frame was that you could get vaccinated a month after an infection. That was actually, for me, I used to tell my patients, get it up to 3 months. Give a chance to others who have not been vaccinated. And it is absolutely fair. Those who have COVID need to give others a chance to be vaccinated and protect themselves, because they are partially protected, at least from severe infections and death, for a period of maybe 4 to 6 months. And if they come up with a 6-month proposal, I'm totally supporting it. I think it's a good thought process. It just spreads the ability to give single doses to a larger population of patients. People who had COVID need to step back for the sake of those who have not yet got a COVID vaccination dose.
Well, so then it's a dose of practicality, a dose of science, and a dose of morality and ethics as well. That's all combined in this cocktail of the new SOPs that have come out. Well, does it work? Will it really solve the credibility crisis that exists even now in some minds? Well, I hope it does, because we have the 2 best doctors in the country advising us. And why not, ladies and gentlemen, should we believe that what they say makes a whole lot of sense for all of us, because we don't know any better than this. Thank you, Dr. Guleria and Dr. Seth, for joining me. And just one point that I would like to, for you to take back is that if this advisory panel had met media more often, answered some of these questions, and not be, completely lost in the paperwork of the studies that they're doing, maybe they would actually bring a whole nation's anxiety several notches down. Today, Dr. Paul has been found after many, many days. We were almost going to set out a search party for him, but many questions being answered today. So thank you, Dr. Guleria and Dr. Seth, for joining me on the News Hour.
Thank you.
So, ladies and gentlemen, now we come to the most